Road carnages, breathing complications, burns and fractures are some of the most common scenarios that are witnessed in an accident and emergency ward of any hospital. In many cases, patients get to this place after being managed from the scene. According to Dr. Benjamin Wachira, emergency medicine has not been taken seriously as it should, with Kenya operating without an emergency medical care policy.
It's the care that you need to receive in a timely manner, otherwise you will potentially either die or suffer permanent disability or protracted hospital stay. So it's that acute care, so usually the care needed to be given within a couple of minutes to a couple of hours, and without which then there's potentially harmful effects to your health.
The Kenya Emergency Medical Care Policy of 2020 to 2030, released early this year, is the first ever policy in Kenya that seeks to establish a working emergency medical care system as a key component of the healthcare system in the country.
We've seen many situations where someone goes from hospital to hospital to hospital purely because they end up in a hospital that is not able to provide the care that they require. So this also is very confusing for the general public. Yes, we're all told go to the nearest hospital. But if you're having a heart attack, a dispensary, as much as it is a hospital by its sense, will not really save your life. So emergency care can only be provided in emergency care centers.
The sorry story of the late Alex Maduga shocked and annoyed all in equal measures. It got even worse when it was revealed that Maduga spent 18 hours in an ambulance because he could not be admitted due to either lack of space in intensive care units or had no money to deposit before he could be admitted.
Whether we develop the system or we don't develop the system. So the idea is emergencies will continue happening whether we have resources or not. So 18 hours brought in the issue of, in fact, the good thing is, sadly, though he passed on, but he was 18 hours in an ambulance. People potentially could spend 18 hours in a vehicle which doesn't have trained personnel or appropriate equipment.
According to Article 43(2) of the Kenyan Constitution, no person shall be denied emergency medical treatment. Relatedly, the 2013 Ministry of Health National Patients' Rights Charter provides that every patient has a right to receive emergency treatment in any health facility. In addressing the regulatory weaknesses of emergency care in Kenya, guidance may be placed on the recommendations made in the ruling of the Medical Practitioners and Dentists Board in the Alex Maduga complaint of 2016. The board noted with concern that to date, there exist several vacuums in emergency medical treatment that will benefit from enactment of an overall emergency care policy at national level.
We will address this through the Emergency Medical Care Policy 2020 to 2030, which will be launched shortly to address these issues. I believe with the COVID-19 pandemic, the need to fast-track its implementation is a priority even as we head to a holiday season, which is usually occasionally associated with many road traffic accidents that test the emergency care service infrastructure.
The 5th African Conference on Emergency Medicine sought to address challenges faced in the field as well as exchange of ideas from other countries. Diana Rose, K24 for the Health Beat.